Hi, I'm Dr. Ngozi, all physician and health educator. So, a lady asked me a question. She has AS, which is sickle cell trait, and she's engaged. Her fiance has AS, and they plan to get married. And they want to have kids, and she wants to know her options because she is aware of the risk of them having a child with sickle cell. So, because both of them have AS. And this is a really good question. Sickle cell is prevalent in some parts of Africa and the Caribbean. And a person with sickle cell has significant um, suffering from the disease. And so this couple really wants to prevent bringing a child with sickle cell. So what are their options for conceiving a child without sickle cell? Yes, there are options, but expensive. So knowing their genotype is important before trying to have a child, so which they already have done. So she knows she's AS and her fiance is also AS. And like I said, the risk of having a child with sickle cell is high. So just to recap, AA is normal. AS is a carrier of sickle cell, but they're usually healthy. And SS is sickle cell. So, the response to this question, I would say, is to explore the options of assisted reproductive technology, under which IVF falls. People with a chance of having a child with sickle cell can use in vitro fertilization, IVF, with pre-implantation genetic testing to conceive a child unaffected by sickle cell. So what does this mean? It means in vitro fertilization is done and an egg is taken from her and his sperm, and the embryos are tested, and the embryo without sickle cell is implanted. So what are the limitations? So the limitations is that this sort of uh, assisted reproductive technology may not be available easily and cost very expensive. There are some ethical considerations as well. A woman has to go egg retrieval, and it's not an easy process of IVF. It's not, like I said, easily available. It is expensive and it can be quite disappointing. Well, I'm glad that the couple is discussing their sickle cell trait or carrier status, and they are fully aware of risk. So this tells me that they're very good with communicating with each other, and this communication is very important because if they cannot afford the assisted reproductive technology that I've mentioned, and they do end up with a child with sickle cell, they seem to have great communication, and hopefully with adequate support, they should cope well. So I'm just providing this content for education. It is not medical advice. Please subscribe to my channel and share this video with your friends. Thanks and bye for now. Have a great day.